Welcome to the webinar, everyone. This is Nate Pelzer with the California Product Stewardship Council. Just wanted to remind you that this webinar is being recorded. All attendees are muted by default. You have the option of sharing questions via the control panel, and technical support can be found at gotowebinar.com, resources, and FAQs. So this is our fifth webinar for the Department of Healthcare Services California Drug Take-Back Program. The first four webinars provided an overview of the program and focused on compliance issues and the ease of taking the survey and applying for a MedBin and the process of implementing a MedBin. So we'll continue with that on today's webinar. Who is CPSC? CPSC is a 501c3 nonprofit formed in 2007 based out of Sacramento, California. Our mission is to shift the product waste management system burden from one that's focused on government-funded, taxpayer-funded, ratepayer-financed waste diversion to one that relies on producer responsibility in order to reduce public costs, drive improvements, and promote environmental sustainability. And our vision is to have producers as the primary creators of waste in the waste stream, to establish, fund, and manage end-of-life systems for their products with state government setting the performance standards and ensuring accountability and transparency. Drug Take-Back Program Overview. So this program, the whole goal is to install about 300 medicine collection receptacles across California. These are the large steel boxes that you see installed in some pharmacies and some police departments across the state now. This program's aim is to rapidly expand the quantity of bins placed throughout the state. This is free of charge, meaning the grant actually pays the cost of the bin. It also pays for servicing through August of 2020, at least. It also includes professional installation and also includes free technical support during the duration of the program. This program also includes a number of webinars. I mentioned that this is the fifth and last webinar in the series. All of the webinars are posted on our website, takebackdrugs.org, for your convenience. We'd recommend that you check those out. Check out the website. Definitely check out the recorded webinars that have been posted on the website at your convenience. And one of the main aims of this program as well is to increase public and healthcare community awareness of safe medicine disposal. We oftentimes state that it's important for people to have options and understand what their options are when they find themselves with unwanted medications, and it's very important to provide options so that they don't feel compelled to put the unwanted medications into the trash or into the toilet. And we're in the process of placing MedBins currently throughout the state. We've already placed about 33, and we're rapidly identifying other locations and installing those as well. Just wanted to send a quick shout out to the funders of the grant, the Department of Healthcare Services. We thank you so much for your partnership and the funding, of course, and guidance throughout the course of the project. Qualifying to be a MedBin host. So it's actually quite easy. It's open to all the counties that currently don't have a MedBin ordinance in place. So all the counties that are currently listed on the screen are those that are not qualified. If you live in one of these counties, you do not qualify for a free MedBin, but we would encourage you to share information about the program with folks that you know outside of these 9 counties. Implementation, federal, state, and local protections. So with a program like this, because it does involve the handling of protected materials and highly regulated materials such as prescription drugs, it's important to point out that federal and state governments have put into place stringent regulatory protections. And the whole purpose of this is to ensure that drugs are handled with utmost care and protection so that you, your staff, and consumers are truly kept safe. So on the screen, I've got listed a number of regulatory agencies. At a federal level, we have the Drug Enforcement Agency. At a state level, we have the California Board of Pharmacy. And at a local level, we have, for example, city and or county Department of Health, Department of Human Services. Most counties in California do not have local regulations that pertain to MedBins, although a few do. And it's your responsibility to check with your local Department of Health or Human Services to see if they have any requirements. Those that do have requirements, it's typically just a requirement to fill out a form and to register the location of the med bin so that they know. So let's start with the first one, the federal government level. That's the Drug Enforcement Agency. We've got posted on our website a registrant fact sheet, which helps you as a potential med bin host understand who could be an authorized collector, what actually can be collected. In this case, it schedules 2 through 5 controlled and non-controlled substances, prescription ointments, pet medications, prescription patches, and over-the-counter medications. It does not include needles or inhalers, aerosol cans, thermostats, lotions or liquids, hydrogen peroxide, or vitamins. The website also includes information on registering. In order to be awarded a med bin, you need to change your DEA status from retail pharmacy, assuming you're a pharmacy that's interested in hosting a med bin, to retail pharmacy/collector. It's very easy to change that status. You simply log into the DEA website, enter your registered retail pharmacy information, change the status, and then click submit. Typically find out the results, your approved results, within 1 business day. Also listed on our website are the full regulations, including the Disposal Act of 2010, which was then published in 2014. It's a highly valuable list of regulations. It's pretty short. The version we have is about 7 or 8 pages long, but it's very easy to understand and digest. And then we also have posted for your convenience some additional resources for folks that are interested in hosting med bins. On the DEA website, it's deadiversion.usdoj.gov, etc. Next on the list is the State of California Regulatory Board. It's the California Board of Pharmacy. So the board has its own set of requirements. We've got those listed on our website as well. You first and foremost need to be licensed by the board. The med bin has to be in a specific location within the pharmacy. It has to be publicly accessible, and it also has to be within the line of sight of somebody who's standing at either the drug pickup or a drop-off location window. And you have to comply with a specific disposal process, which we've outlined and have posted on our website. In fact, we've got some very handy videos. They're about 2 to 3 minutes in length that describes the disposal process, how easy it is to open the bin, slide out the full liner, flip over the cardboard lids on the top, which are self-sealing, and then slide it back inside until somebody comes and picks up the full liner and the packaged liner, which is usually done within 1 business day from making that request. The California Board of Pharmacy also has full regulations posted on our website. The specific document you want to look for is called 16 CA ADC subsection 1776. That's also a very short document. It outlines many of the same things that are currently posted by the DEA, so there's a lot of overlap there as well. And then we've got some additional resources shown here with this link. That's www.pharmacy.caws_regs/1776_OA.pdf. So we've got that link both in the presentation and also on the website as well. And then I also mentioned earlier that you've got some possible local requirements. Again, it's typically just filling out a form that shows that you're a retail pharmacy/collector or a police department. Again, this program, as I mentioned in previous webinars, it's open to pharmacies, hospitals with pharmacies, and law enforcement agencies. So if you're a sheriff and you'd like a med bin and you're in one of those counties that does not have a med bin ordinance, or if you're a pharmacy or a hospital with a pharmacy, then you qualify to apply for this program, and chances are you'll be selected to receive a free med bin. So again, check with your local county or city Department of Health, Department of Human Services for any requirements they may have that are specific to hosting a med bin. In previous webinars, we've gone in rather deep into the process, the disposal process, and I'll do that again today. When you get the med bin, when you're awarded a med bin, we'll send a team of professionals to visit your location to install the bin. You'll also receive via separate email login information for the web portal that we use to monitor and to keep track of the liners you receive, which are also included as part of this program. Each one has a special serial number that has to be logged into the web portal. When the liner is full, you simply log into the web portal, click on Call for Pickup, would do at that point is recommend that you open the bin, slide out the full liner, package it as I previously described, and then slide it back inside, and then lock the hatch so that no additional drugs can be put inside the bin. The third-party common carrier will come in about a day, oftentimes less than 1 day, to pick up the packaged liner. You have saved at your location, probably in some back room, out of public reach, the additional liners, which we provide to you. You would then unbox the liner, put it inside the empty med bin, and then lock the front door. It's then ready to start accepting additional unwanted medications, so you would unlock the hatch as well. You can see I've got that outlined here on this slide. It's a very easy process. Packaging is easy. Shipping is quite easy. The nice thing with this project is it's not paper intensive. Everything we do is managed through a web portal. We provide to you process documentation that outlines step by step everything you need to do to get the web portal set up, identify users, and how to call for pickup. You can see the last bullet point here. I did want to draw your attention to this. The pharmacist documents the activities and arranges for pickup again via the portal. It is the lead pharmacist's responsibility to identify who shall open the med bin and package the full liner. That always needs to be done by 2 people. It's typically done by the lead pharmacist and an assistant, and that needs to be documented on the web portal as well. So keep that in mind. Okay. This project also includes an envelope overview. We've recently completed negotiations with DHCS regarding how the envelope portion of this project will unfold, no pun intended. We're going to focus on 2 large counties, 3 medium-sized counties, and 3 small counties. What we'll be doing is we'll be working with the departments of health in those counties, law enforcement officials, and a number of other stakeholders to distribute the unwanted safe disposal return envelopes, which are all postage paid, for folks that aren't able to get to the med bin. So we're really excited about this program. It's essentially going to run as a test project for DHCS, and based on the results we find with this test run, then it's likely that the project will be expanded statewide, although it's not definite at this point. So we're excited to share details with the general public about this program in the very near future. If you have any questions about this portion of the project, feel free to reach out to me. Again, this is Nate Pelzer with the California Product Stewardship Council. My contact information is online on our website, takebackdrugs.org, and also at the end of this presentation. Press and media. Another major component of this project is providing you as a medbin host with free press. Our goal is to share information with the community about how they can dispose of their unwanted medications, again, to share with them the options they have. We want to make sure that the community is benefiting from this new option and that they understand that they have options when it comes to disposing of unwanted medications. So we provide a lot of free publicity to medbin hosts. We issue press releases. We post quite a bit on social media. We're also in the process of creating mail inserts, which will be sent out to target counties across the state. So we do everything we can to promote you, again, on social media, listservs, our website. We also have a wonderful online map where anyone can very quickly and easily determine where the med bins are located in their local community. The website that you would go to see that online map is takebackdrugs.org. You click on Find a Bin. It drops you down to the map, and you can zoom in and see how many bins are located in your area. We also promote medbin host locations on conference calls, again, press releases, and the list goes on. So we're really excited about sharing information with your community about the medbins that are hosted in your community and the new options that are available to folks when they find themselves with unwanted medications. So next steps. If you're interested in hosting a medbin, it's a very easy process. The most immediate step you would do is to take some photos of where you'd like the receptacle located inside your facility. Again, the receptacle needs to be posted or installed in a location that's accessible to the public. So you can see here in the picture to the right, this is a pharmacy. The gentleman on the right is standing right next to a prescription drop-off spot. So it's convenient for everyone that comes in. The general public has access to this med bin. You can see myself on the left. I'm opening up the hatch and dropping in a bag of unwanted medications. Very easy to use. You can see the front of the bin. It has 2 locks. 2 handles. Those are the ones that need to be unlocked when the liner is full and is ready to be removed. So the dimensions for the bin, it's about 25 inches by 25 inches at the base, so it's about the same footprint as a standard office chair. So take pictures of where you want the bin located. Make sure you have those handy on your computer or on your phone. Go to the website that's posted on this slide, surveymonkey.com, and complete the application. The applications typically take 5 to 7 minutes to complete. We'll ask for you to upload the photos at that time. And once it's submitted, we receive immediate notification that an application has been received. We review it. We reach out to the potential medbin host to clarify any information gaps, make sure that we have all the information we need to approve you as a medbin host. And what we do after that is we reach out to you regarding next steps, and we start discussing any necessary paperwork that needs to be completed. We have a waiver of liability and an agreement that would need to be signed. So it's a very quick process. We've installed medbins in as little as 1 to 2 weeks. So let us know how we can help you. You have the opportunity to share with me any questions about what I've shared with you in this presentation. Just want to make sure that you can see on your screen that you do have the option to share any questions. And it looks like I've got somebody typing a question now. Okay, so the question is about ongoing funding past the end of the grant. So this grant includes free medbin, free installation, free technical support, and free servicing through August of 2020. And what we're doing now is we're working with both the state and a couple of other entities to provide ongoing funding for servicing between the end of the grant, which again is August of 2020, and the start of SB 212, which is in early to mid 2022. That's when the pharmaceutical companies will be required to pay for ongoing servicing on an ongoing basis. So we don't have any definite answers at this time. I am happy to report to you that the ongoing servicing cost is very inexpensive. It's only $165 per service. Most of the bins that we have placed get theirs serviced every 3 to 4 months, so the costs are minimal and are oftentimes easy to absorb into the pharmacy's budget or the police department's budget. So we're very optimistic that we'll be able to identify ongoing servicing funding sources sometime in the next month or so, and we'll certainly share that with you now. But again, this program is really soup to nuts, as I like to say. It includes the medbin, ongoing servicing through August of 2020, free installation, and free technical support. Okay, next question. It's regarding mounting of the bin. That's a very good question. Each of these bins are mounted into the floor. They've got 4 feet at the bottom of the bin, and per DEA requirements, we are required to mount them into the floor so they can absorb upwards of 750 pounds of force. We typically drill holes into the floor about 1 inch, 3/4 of an inch, 1/2 inch, depending on the floor surface. Most of the bins we've installed so far have been mounted into a floor that's comprised of a vinyl surface on the top and then cement down below, and I think we've gone about 1/2 inch to 3/4 of an inch deep. Creates a little bit of a mess, but it's easy to clean up, and it allows the medbin to be fully DEA compliant. Excellent question. Any other questions? Okay. Free press releases and other media. So somebody was wondering where we can find press releases and other free media. So we post all of our social media on our website, on the Facebook website. So check out California Product Stewardship Council on Facebook, and you'll see the free media there. If you'd like a copy of press releases, please email me, Nate, at calpsc.org, and I'm happy to share with you any press releases that have been released to local media. Again, those are just 2 ways that we share with the community the locations of the new medbins. We also mention them on conference calls and various other press interactions. So just let me know if you'd like to see a copy of one of those press releases. And those are all the questions that I've received so far. Oh, there's another one that just came in. Is the bin only for pharmacies? No, the bins have been placed, and the grant allows for placement of the bins in pharmacies, hospitals with pharmacies, and also law enforcement offices. So that would include sheriff's departments, police departments. We've also done probation department as well. And let's see here. Okay, last question just came in. Said someone's looking at the map on takebackdrugs.org, and they have sharps containers installed in their town. How do we get sharps containers added to the map on your website? It's a very good question. If anybody knows of any medbin locations or sharps bin locations, just send me an email with a list of those locations, and I'll get them added to the takebackdrugs.org map immediately. Again, my email address is nate@calpsc.org. And I've got it on the screen right now. Again, that's nate@calpsc.org. Again, please share with me any locations that you might have that you're aware of for the sharps bin locations and the medbin locations as well. We're developing quite a wonderful resource, a highly valuable resource, which is the map on the website, takebackdrugs.org, and also don'trushtoflush.org. That same map is located on both locations, and we've got sharps bins located throughout the state, med bins as well, and we would love to include yours too. Those are all excellent questions. Just running through my list to make sure that I've got them all, and that's it. This concludes.
Nate, it looks like
Yes.
one more came in there, and I can read it out if you like. Can your GIS data be shared? We'd love to locally promote the location of medbin locations.
Of course. And that came from Lisa. Lisa, please send me an email, nate@calpsc.org, and we can talk about this further. We would love to share the locations of the bins. Thank you for volunteering that. We really appreciate that. Okay. This ends Webinar 5. Thank you so much for your participation. We highly encourage you to apply for a medbin, whether you're a law enforcement office, a pharmacy, or a hospital pharmacy. Would love to place a medbin in your local jurisdiction. Again, this is Nate from California Product Stewardship Council. Thank you so much for participating, and have a wonderful day.